Okay, hi, good afternoon, everybody, and thanks for joining us this afternoon. I'm Zoid Khan. I'm the head of philanthropy at Intellidex in Johannesburg. I started in this job in January after quite a long stint at the University of Johannesburg, where I lectured and did applied research and development studies, primarily in relation to youth unemployment and social protection systems in emerging countries. And in the short time that I've been here, I've got to know quite a few of you, and hoping to interact a lot more with all of you in the near future. So again, thanks very much for making the time to join us this afternoon. I think that for just about all of us, being under lockdown and being at home doesn't mean that the pace of your work has decreased at all. I think on the contrary, the demand for the work that the foundations are doing has increased enormously as the continued and combined impacts of COVID-19 and the attendant lockdown both amplify existing needs and also create new ones. So I'm hoping that as we share some of the insights from our work today, that you will find this useful in trying to find your way through this unprecedented and multidimensional challenge. So before we get started, just some housekeeping. We have 5 presenters today, and each presenter will have approximately 10 minutes to present. And after each presentation, we'll have a short round of questions, so per speaker, of about 5 minutes. And as you listen to the presentations, please feel free to type your questions into the Q&A facility that's in the control panel at the bottom of your screen. And then in the question time, we'll address those one by one. Okay, so first up, we have Peter Attard-Montalto, who's the head of capital markets research at Intellidex, joining us from London. And he'll be presenting an analysis of South Africa's response to COVID-19 and the implications for the South African economy. So over to you, Peter.
Cool, thank you very much, Zohib. So we're going to run through a few quick slides. We gave a much more detailed, very long presentation the other week on the macro response. You can find it on our website. But here, just trying to draw out a few individual important aspects when it comes to the broader topic of discussion in our webinar today. So I think the key thing for us on the macro side is this crisis started moderately earlier, I think, than a lot of people expected. We started to see a global demand shock developing from Asia from the very start of the year. We then started to see, before the full lockdown in South Africa, we should remember that the lockdown in a softer way started from the middle of March, the 15th of March, when a state of disaster was declared, when restaurants and bars started closing, when social distancing started to be put in place. And that's really the time when we sort of measure the start of the economic impact in its fullest. But the economic impact is going to stretch throughout this year. And it took some time to really see, I think, the full impact of the epidemiological response from the lockdown coming through. We're still seeing the data has some questions around it in terms of variances in testing, for instance, between provinces. But the lockdown certainly has had an effect in slowing the virus down. But really, the key for us early on in the crisis was the fact that an economic response package was not put in place for a month until announcement in the middle of April. The initial response was much smaller, involved some employment support from TERS, that was UIF extending money. That program still struggling to get into gear and to pay out money at any speed. And it wasn't really until into the middle of April when we saw the full economic support package announced that we actually, I think, started to see something that can provide some more meaningful foundations underneath this slump in growth that we are actually seeing. And we'll come on to analyze that a little bit more later. But if we flip on to the next slide, I think the real issue here has been what is the linkage between the underlying progression of the virus and the economic response, and then the policy response on top has been very hard to decipher. Now, there's been a lot of pushback against the lockdown, exactly how it's progressing between stages, for instance. And that's going to be a big topic for debate this week when the National Command Council meets and considers easing the lockdown a little further. But the key factor for us is that the virus hasn't been stopped here. We simply slowed the pace of progression of the virus. The top right graph there is the doubling time of the cumulative number of deaths from COVID-19. It's coming in at about 11 days or so at the moment, doubling every 11 days. And if we ease the lockdown from here, that should fall, i.e. a faster pace of doubling as we move forward. But the Department of Health has actually been quite clear that given the seasonality in South Africa, the full peak of this crisis isn't expected now until the start of September. Some uncertainty, some different views coming out there of exactly when it is, in August or September. But broadly, we've stuck with the view of it being the start of September. And so we still have a full sort of 4 months or so to go of this crisis until peak. And I think we should bear that in mind if we do see easing of stages this week. If we see even softer forms of lockdown in response to business demands come through, that this is still a long crisis to go. We should remember in the Northern Hemisphere, we've had these sort of short, sharp, sort of 6 week or so periods or 2 month periods of the crisis, then falling away and easing now, and perhaps then a second wave in winter. South Africa is having those two things, if you like, squidged together in one longer crisis. And that's how we get to some more negative forecasts that we will get onto in a moment. But I think the Actuarial Society, who put out the paper at the start of last week from their own modelling, really, I think, drove the point home that the sort of current, tick up of till 10 or so new deaths from COVID-19 a day we're seeing at the moment really is nothing versus the peak. And they were saying in that paper that into July and August, we will see maybe around 1,600 new deaths from COVID-19 per day. There are some reasons to think that's a little high or a little low. There are some risks either way. But I think it shows that the crisis in its sort of full form is not yet upon us. And again, we have to think about the full progression of this as we go into winter in South Africa, alongside the normal decline in respiratory health, the seasonal flu outbreaks, etc., that we would normally expect to see. And so the full weight of the outbreak coming on the health services is not really going to be seen for another couple of weeks yet. We move on to the next slide. Thanks, Zoe. So I mentioned about the stimulus. I think the initial problem for us in thinking about how government put together the stimulus was the first conception through February and March from Pretoria is very much this was a very, very large shock to the system, but was somehow a normal shock. It wasn't an existential shock. It wasn't business closures. It wasn't necessarily forcing the economy to shut down. And that's taken some time to percolate through the system, and hence why, and then generate a response and a policy response. And that's why it's taken some time to get to this stage. Now, the SARB moved fastest. They were able to cut rates by 225 basis points so far this year, loosen capital controls, things like that. But all that for us provides a degree of accommodation, particularly as banks start making losses as opposed to real stimulus. They can cut rates further, but those sorts of stimulus measures don't really impact particularly the lowest income deciles in society. And whilst important, clearly a larger range of support was needed. We've seen Treasury, we think, on the back foot somewhat in terms of the conception of how the lockdown will happen. We've seen a much more, if you call it, microeconomic fiddling mode, particularly driven by the Department of Trade and Industry, trying to be much more granular in terms of dictating individual employment levels and individual sectors, etc. And that's really, I think, shaped the sort of style of response and the impact of level 4 lockdown now in particular, or in terms of the growth forecast we'll come on to in a second. But I think, got this realization then through April of the need for a stimulus. South Africa was lagging the sort of global ranking graphs that you see of how South Africa does. South Africa basically was on the far right hand side at around 0 initially. Clearly they wanted a big whack, and that's why we came out with a 10% of GDP stimulus, 500 billion. But we need to sort of analyze really how that works. And it's very costly, and that's where IFI funding, IMF funding, etc., is now required to plug the gap for this stimulus program, for the underlying loss of revenue from the fiscus, and hence, a lot of risk on the macro side is being run by necessary risk, certainly, but a lot of risk in terms of bringing the stimulus plan forward. If we go on to the next slide, we can have a look in a little more detail. We break down the 500 billion stimulus. The largest part is the loan guarantee scheme, 200 billion rand. We think that's the highest fiscal multiplier impact as well, and positive on growth. But the next largest is actually a negative. It's the reprioritization of 130 billion of expenditure as government tries to make room within, at least to some extent, within the existing fiscal framework for this stimulus plan to be affordable, given those fiscal constraints, these funding constraints that South Africa is under. You add in the extra health expenditure, that's 20 billion rand. That's a decent but a small overall impact. The step up in grants, again, very necessary to bring that in, but is small in the grand scheme of things of stimulating GDP, the unemployment benefit, these sorts of things. And we get overall, we think, about 6 percentage points of support into GDP, which in historic terms, of course, is huge for South Africa. But we should remember this has sort of been thrown into an expanding hole as the crisis progresses. And if we go on to the next slide, we can see how we've downgraded our growth forecast over time from sort of 1.2 at the start of the year through the various declaration of disaster. That was an important moment when they announced the border would close. The big impact we put into our GDP forecast at that time from loss of tourism revenue. You should remember tourism is one of the biggest labor multipliers in the economy through the lockdown. And we sort of ended up with a minus 16.5% decline in GDP for this year before we started thinking about putting the stimulus plan on top. And that's how we then get back, adding 6 percentage points on to our minus 10% growth forecast for the year. But that means 1.7 million jobs lost. It's important to, I think, emphasize that's actually formal sector jobs. That is not the informal sector. The informal sector would be a lot higher. Some estimates there coming in at 1.5 to 2 million even informal sector jobs losses, casual workers in particular. And that's, I think, where it's important to consider the two levels of this crisis. It's very easy to model this, well, easy, quote unquote, to model this in the informal sector, but the much deeper impact on the economy in the informal sector is equally as important. We've seen some survey evidence around the informal sector, the lack of savings, certainly in that segment of SMMEs operating there. And that's why we shouldn't certainly forget that, even if the headline numbers very much rotate off the formal sector. There's been a lot of discussion of numbers of impact on different stages of lockdown. A famous 13 billion number has emerged. That was from our modeling, the graph on the top right there. The way we do it is we look at the impact of growth loss for a given stage on headline GDP on an individual day. We think for stage 5, that's about 8 billion, about 4 billion for stage 4. But then there's a long tail we have to consider beyond that. That's the impact of growth and output lost on a given day that has then on the rest of the year. That's things like firm destruction, step-ups in unemployment, those sorts of issues, gumming up of supply chains, lost tax revenue, etc. And when we add that on top, we get to the headline 13 billion a day impact from a day's loss to stage 5. And then it comes out as around just over 5 billion for stage 4. And I think, again, it's key to consider not just your losing output on a given day, but these longer tails of impact as well. We go on to the next slide. The key for us and for the whole economy in supporting society very much is going to be nominal growth in the medium run. The fiscal hole that South Africa is now finding itself in can only really be rescued in the long term by nominal growth emerging. Now, that means structural reform. That means being able to support all levels of society through redistribution, through having a tax system that has the growth behind it to generate tax revenue, as opposed to seeing these sort of permanent losses of output, permanent losses of revenue for the fiscus. And the problem is the government is resting on that occurring through this sort of structural reform. But from the last 2 years, I think investors and companies are very skeptical of that really coming through. And hence, some pre-commitment needs to be shown by government, undertaking some challenging things, say in the energy space right now, to boost investment and to keep markets and investors and companies on shore and on side. But ultimately, I think, and this is always the case for emerging market economies, you either do the structural reform yourself or you're forced to by someone else. That can be from the IMF through a standby arrangement, an SBA, where it's the classic, very politically contentious form of conditionality-based borrowing that South Africa would have to turn to the IMF for. You can do it through the SARB stepping up, and providing more real QE, but in reality, that would only happen probably with an SBA, with some form of proof of structural reforms happening for the SARB to be happy to do that. Or you could do it with a Chinese bilateral loan, but China ultimately wants to see growth happening in the countries they lends to and would impose very strong non-economic conditionality around geopolitics and things like that. So there's no easy way out in the long term, apart from growth, to lift the economy, to revitalize the tax base in the economy. Let's go on to the next slide, and a reminder, you can put some questions in the Q&A function.
If got a minute left, Peter. 1 minute to go, please.
Sure, yeah. Then if we just think about, as we come on to the next speakers, the sort of deep impact that this is having on society. The key issues coming up through this year are these cliff edge risks, where government's going to have to decide, do you have a continuation of these step-ups in social grants of the temporary unemployment benefit, or can they be stopped? That's an incredibly politically challenging thing to do. Clearly, maybe and probably very necessary to keep them going, but clearly has deep fiscal risks. It's the same for the guarantee lending program as well, where interest payments are meant to start kicking in after 6 months. And a lot of challenging, I think, goings on around politicization of the handing out of support as well. Some long-term impacts we need to consider around inequality, in particular as things probably get more expensive, things like air travel in South Africa, things like going to restaurants and those sorts of things, as well as you're enforcing social distancing. So overall, I think if we flip on to the next slide, just to sort of summarize, we need to see fast nominal growth to rescue the economy in the medium run. We need to see some consideration for these cliff edge risks coming forwards. We need to see some fight, I think, against more economic regulation, more economic nationalism, trying to onshore and do industrialization onshore too much, and trying to solve all things at this time of this crisis. But very much a lot's going to happen in the next couple of weeks around the next stages of lockdown. But I think the overall takeaway message from me is that the crisis still has another 4 months really to rumble until the peak in the virus outbreak, maybe into the start of September. And so I think we need to keep that very much in mind, thinking about support into the economy and for society. So that's my slides. Thank you very much. Were there any questions at all, anyone? I don't think there are any questions in the Q&A. We can always come back to any later, but thank you very much from me.
Okay, thanks, Peter. And as he's just said, if you do have any questions that come up over the course of the webinar, please don't hesitate to ask them we have one. So this is from Shane. Peter, do you see that?
I do, yeah, thank you. So in terms of SMMEs, we've had the Small Business Support Department has put in place a facility now that's been legally challenged based on the rules for applying for it, how empowerment applies to it. It seems to be somewhat challenging, them getting money out the door at any great speed, certainly. And and in our sort of table, looking at the economic impact from that, we've assumed quite a low multiplier because we think it's quite hard to get that money out of the door. The biggest element, though, is that loan scheme, loan guarantee scheme, which of course is meant for SMMEs primarily, and for them to see bridge financing and consolidation of outstanding debt through this new facility, COVID-19 facility. That's officially got launched this week, even though it was announced sort of a month ago. The design of that to us looks pretty good. It looks like it will provide support certainly into that segment. The question is, do banks react to risk averse to it, and in terms of actually handing it out? For us, I think if you're not assuming a large enough risk in the banking sector for that, dealing with these pretty challenged SMMEs clearly in terms of cash flow, etc., you're not necessarily doing it right. But we give benefit of the doubt certainly on that at the moment, and hence why that's the largest part of our view of the stimulus impact on growth. There's tax holidays, of course, as well for people, which are open to all companies, but the sort of automated SARS tax holidays have been put in place are primarily designed for SMMEs. So there are a range of different things. I think the real challenge for us has been thinking about the efficacy of how those policies are really laid out. Is the key challenge for us, and the size of them as this thing drags on, and ensuring then they're tapered correctly on the other side, and you don't see those cliff edge problems where the economy recovers very slowly, but things are cut off faster in terms of support. Some other questions just coming in on.
So I think, Peter, sorry to interrupt. So maybe we could just take one more. So perhaps James' question, and then should we have time at the end, we can revisit these.
So there's a question then on how non-profits are being treated. There have been some localized support for non-profits from business rates, for instance, in some metros, but currently that seems very limited on a national level. We've seen some things in some areas, like in the arts, for instance, as support package put in place. But no, I mean, overall, I think it's been very limited, overall the level of national support from policy that we've seen. And I think, as we move forward through the length of this crisis, I think those kind of things will become more obvious to government, and more pressure will be applied on government for support around that. I think around support packages for non-profits has certainly been lower down the agenda and the stimulus so far. But we'll come back to some more questions at the end. Thanks everyone so far.
Thank you, Peter. So next up, our second speaker is Dr. Maurice Goodman, the Chief Medical Officer at Discovery Health, and he'll be discussing the impact of the epidemic on the South African healthcare system. Dr. Goodman, thanks for joining us. Over to you.
Thanks, Eb, and thank you to everybody for the opportunity to participate in this very critical debate. Before I dive into the detail of my presentation, just a couple of points. Firstly, everybody hopefully knows that today is International Nurses Day, and in fact 2020 is the International Year of the Nurse and the Midwife, and I think that's quite appropriate. We do need to pause and recognize these heroes, the nurses and other healthcare professionals who in fact are on the front lines of this pandemic, keeping us all hopefully safe and well, and I think we need to constantly bear that in mind. Also, if you'll permit me a personal note, but I think it does have bearing. Some of you may know Dr. Clarence Minnie. He's the chair of the Council for Medical Schemes, which is the regulator of the health funding medical aid industry. It's been in a senior leadership position in the health system for many decades. Unfortunately, in the early hours of this morning, he succumbed at the age of 69 after about a 3 or 4 week stint in hospital to a COVID-related illness. Besides being a close personal friend, I think that does bring this debate into sharp focus. I mean, we're sharing high-level statistics and numbers, and that is important to manage, but I think we do need to remember that behind all of this are real people and we all need to bear that in mind going forward. So just to Clarence and his family, will miss you, and the country will miss him. It's a deep, deep loss. Moving into then the detail of the talk, and I've been asked to give a kind of multi-dimensional view of the impact of this from a health perspective, and I thought hard and deep about it. For those of you who aren't entrenched in the healthcare industry, the healthcare system, it's very useful to think of the system at a macro level, perhaps in terms of a demand side. In other words, that's the burden of disease, people getting sick and placing demands and healthcare burdens on the healthcare system. And then there's the supply side, which are the doctors and the other healthcare professionals and the hospitals, etc., that are there to supply the healthcare that's required. And then further within that, there's certain direct impact that this COVID pandemic is making on both our demand and supply side, and then there's an indirect benefit. So I think that I'd like to structure my talk perhaps around that. So if we start off looking at what I think most people have been focusing on, which is the direct impact of COVID on our healthcare system. So really, we've all been swamped by statistics and numbers, and I'm not going to spend much time on that. In fact, humankind has faced a number of pandemics, the Spanish flu and Black Death, the bubonic and pneumonic plagues. This is the first infodemic that's kind of accompanied the pandemics. There's a lot of numbers and statistics floating around. Some are fake news, some are true. But I think we all have the numbers at our fingertips, and it's important to differentiate between those that add value and those that don't. So I'm just going to focus on a few of the high-level principles, really. And so just to state that this COVID pandemic comes off the back of South Africa's so-called quadruple burden of disease. We have a very high infection or infectious disease rate, mainly driven by HIV, AIDS, and TB. We also now have a non-communicable diseases like diabetes, type 2 diabetes, hypertension, etc., which in fact has eclipsed our communicable disease burden. Also then maternal and perinatal morbidity and mortality, and then a very high rate of trauma related disease, largely alcohol and road accident driven. I think that's South Africa, I think, as a result of that last statistic, is maybe the only, or certainly the leading country who in the last month or two of COVID, our overall death rate has in fact decreased. And that's as a result of the lockdown, bans on alcohol, clearly very few cars on the road, etc. So overall, our death rate thus far has in fact gone down. Unfortunately, that's not going to maintain. As the previous speaker said, we're on an upward trajectory. We've crossed the 10,000 mark in terms of infections and the 200 mark in terms of mortality. And we are unfortunately headed for a bit of a perfect storm. As was mentioned, the peak of the pandemic is likely to happen during winter. Well, in fact, we'll only start coming out of the peak in spring, at the end of August, September. And unfortunately, the clinical presentations of the influenza and COVID are quite similar. And so our healthcare system is indeed due for a rough ride over the next few months. Having said that, thus far, we have coped well. The World Health Organization, in fact, recognized that due to our very strictly kind of scientific-led response, that thus far we have done well. Our case fatality rate is under 2%, which is one of the lowest in the world. Again, hopefully it stays that way. There have been various theories. Is it due to the kind of lower age average age in the South African population compared to Europe, because certainly in the younger ages, the mortality rates are close to zero. As one gets over 60 into the 70s, and with comorbidities like diabetes, hypertension, those rates increase quite dramatically. So a nutshell of the direct impact on our healthcare, on the demand side of our healthcare system. There are, though, very important indirect impacts. I've mentioned on the positive side the decrease in trauma, morbidity, and mortality, but then we start getting into competition for scarce resources. A lot of our testing kits, GeneXpert and others that have been used extensively for detecting other diseases endemic in South Africa like TB, have been repurposed. We've got to be very careful that we don't take our eyes off our existing disease burden. Diseases like TB have mortality and morbidity rates much higher than COVID. And so whilst we're dealing with the immediate crisis, we can't take our focus off those. There are other infectious diseases. As we know, good vaccination campaigns have kept diseases like measles, etc., at bay. But there are concerns that, you know, under the current climate, vaccination programs lose focus, and then if herd immunities drop below certain critical levels, once again, morbidity and mortality from diseases such as measles eclipse those of COVID. So we can't stop worrying about those. I mentioned that non-communicable diseases, type 2 diabetes, hypertension, dyslipidemias, have now become the major driver of the burden of disease in South Africa. And the cardiologists and other doctors are telling us that largely fear-driven, patients living with these chronic illnesses are not coming for their checkups, for their follow-ups, and one's got to be the kind of heart attacks, strokes, etc., that manifest out of those diseases also obviously carry very high morbidity and mortality rates. So we've got to, whilst we're watching the direct impact on our demand side, we've got to be very cognizant of the indirect impact in terms of channeling resources and focus away from our existing disease burden. Of course, the ever-present malnutrition, we know that millions of children in this country are reliant on school feeding programs, etc. And whilst that's offline, they're exposed to dangers and the complications of malnutrition. So that's a snapshot of the demand side. If we turn our focus to the supply side, again, understanding that South Africa has a significant shortage of healthcare professionals, doctors, specialists, etc. In fact, that was the driving force behind our Discovery Foundation, which is invested in ensuring that our academic sector, the training of doctors, specialists, etc., keeps strong. We have a very low number of those to start off with. Now, what we've got to be careful of is this disease is having an unprecedented negative impact on healthcare professionals in the front line. Firstly, physically, a number of nurses, doctors, other healthcare professionals have in fact themselves become infected, some of them fatally with this disease. And besides the actual impact of the disease, the knock-on impact, if you consider a doctor perhaps becoming infected, then needs to go into a 2-week quarantine as those numbers deplete the system. So it puts more impact on the remaining colleagues in the system. So a very worrying direct physical impact on the system. Also mentally, for the first time among my colleagues, there's real fear amongst the healthcare professional. Again, the backdrop you might not be aware of, globally, there's very high levels of suicide and anxiety amongst doctors. A recent study in the US showed that the suicide rate among doctors was double that of the normal population. And in the UK, a study of female doctors showed a 4-fold increase in suicides and anxiety, etc., as opposed to the normal population. There are a number of reasons of those that we won't go into, but clearly the additional mental stress that comes with treating this disease and being on the front line of the diseases is very worrying for our dedicated healthcare professionals. If you look at the efficiencies within our healthcare system, there's the whole process now that's come into place of so-called donning and doffing. If any of you have been to hospital or seen a doctor recently, there's a whole process now of putting on the PPE, the gloves, the masks, the gowns, etc. It's very uncomfortable working like that. Nurses work shifts like that. It's difficult to work. It takes time. And if you just look at the normal process flow, the management of patient flow through hospitals, once again, that's been severely impacted. So huge impact on the efficiencies of our healthcare system. And then if you look at the private sector, in addition to the mental stress of the disease itself, there's been huge financial pressure on practices. We've seen in the Discovery medical scheme stats, there's about a 50% drop in admission rate to hospitals. Out of hospitals, the so-called consulting specialists, GPs, etc., are experiencing about a 30 to 40% decrease in patient numbers. But if you look at the procedural specialists, the surgeons, the anesthetists, they're seeing, and particularly specialties like ophthalmologists and dentists, are seeing up to a 60, 70% drop in patient numbers. So that obviously puts huge stress on their practices. And then compounding all of this, severe shortages.
Sorry to interrupt. Just a minute to go.
Well, okay. What I'm going to do then is I just want to mention another negative indirect impact is the impact on the training of the doctors of the future. But I do want to leave, I want to say that there are some positives that I don't want to be totally doom and gloom. South Africa's lagged global trends in certain healthcare innovations like digital, the adoption of digital medicine, virtual consults, etc., which are really positively transforming healthcare globally. Due to certain regulatory constraints, we've significantly lagged the world in that. As a result of the pressure on doctors and on practices from COVID, the HPCSA has recently updated their regulations, which does now liberate the system to engage in virtual consultations, distance medicine, so particularly for low resource settings, patients reliant on the state who don't have easy access to doctors and facilities. That's a very positive move. And then just on the supply side, again, an unprecedented coming together, I think, of our private and public sectors, things like the Solidarity Fund, Business for South Africa, who've really come together, addressed issues like the shortage of PPEs, ventilators, rapid buildup of capacity that really is unprecedented in this country, and then displays of goodwill. I mentioned underutilization of doctors in the private sector. There's been a huge surge of goodwill in these doctors volunteering to work pro bono with indigent state patients. And so perhaps all of this does lay the tracks for when the dark days are over and when we do emerge from this pandemic, perhaps things like universal health care, etc., have come a little bit closer. I'll stop there.
Thank you, Dr. Goodman. Do we have any questions? Let's see. Okay, so we have a question from Shane. What is the skill shortage on medical professionals in South Africa, and how do we combat that going forward?
Yeah, thanks, Shane. It's I can quote in the doctor world, we currently, if you compare ourselves to European countries, etc., we probably have a 3 or 4-fold shortage in doctors, about a 6 or 7-fold shortage if you look per 10,000 of the population. This isn't a new problem, and as I mentioned, our Discovery Foundation, we formed exactly to combat that. The Department of Health is looking at a number of remedies, stepping up the production of doctors through medical schools, and we're trying to partner with them in trying to ramp up the production of doctors, perhaps doctors coming in from other countries, although that brings with it its own problems. But certainly it's a big problem that we do need to address.
And we have another question from Tabang. As a health professional, what is your opinion about Artemisia currently being rolled out in Madagascar? And do you think other African countries, including South Africa, are lending enough support in terms of research to test its efficacy as suggested by the WHO?
So indeed, one of the positives that I didn't get a chance to get to is in fact this real collaborative global effort into research, where indeed South African scientists, which we've known for a long time are world-class, are actively participating in the global research. So in terms of our contribution to that, it's great. In terms of any particular treatment or cure, firstly, I'm not an expert in that, and secondly, it's very, very early. The World Health Organization, various scientists are working very hard on finding a vaccine. Depending, the most optimistic estimates say maybe that's 6 months away, maybe 12 months away. Various other medications have popped up as possibilities. There's certainly no credible body of evidence yet to support any of these, unfortunately. We'll have to be a little bit patient.
Okay, and the last question we'll take is from Senzo, who's asking, so early science tells us that children under 18 or more, and more so under 10, are not susceptible to COVID-19. And what are your views about preschools and ECD centers opening, and what kind of guidelines should be in place?
Okay, so I'm not going to get sucked into political debates, but just to endorse the fact that absolutely global statistics show that under 10, the mortality rate, I think, is 0, and between 10 and 20 is very close to 0 as well. So certainly the mortality rate in children is significantly lower than in adults. And there's also evidence to show that for certain reasons, they don't appear to transmit the virus as well. So I won't get sucked into the school debate, but just to say medical science is showing that younger children are much more protected and a much safer bet than adults.
Okay, thank you, Maurice. That was really informative, and thanks for making the time for us this afternoon.
Thank you for the opportunity. I appreciate it.
Okay, next up we have Mr. Sizwe Xasana, former CEO of the First RAM Group and founder of the Sifiso Learning Group. He's also an executive member of the Zenex Foundation, and today he draws on this experience as well as his work with several other trusts and foundations to talk through how foundations are coping with the heightened need the face of the epidemic. Sizwe, thank you for joining us.
Well, thanks very
share
much.
my screen.
All right, thanks very much, Zaheb, and thanks to the previous speakers. So if you just go to the next slide, please, Zaheb. So, I mean, obviously, if we look at COVID-19, when it caught all of us unawares, even though, I mean, we started seeing things that were happening in China, and things started to spread in the rest of the world. And it was really a question of time before, you know, COVID was going to be here. So it wasn't a question of whether or not it was going to come here. It was just a question of when. But, you know, I guess we're all caught, you know, without preparation. I think what was important, and just going back to the point that was made earlier is that our government acted quite quickly, which is quite important because in the actions, I think there was recognition right earlier on that government didn't have the fiscal capacity to deal with the challenges that were coming. And therefore, for instance, the call by the president, even just before the nationwide lockdown, for people to work together, created an environment where, we started to see foundations, business working together and pulling together with government. And that was really important. And, the creation of the Solidarity Fund was quite an important outcome of that, because what it did, it allowed for people to start working together. But there were a couple of other things which happened. SARS, as we know, there are a number of foundations that maybe could not play any role in supporting whether it was the humanitarian efforts or the medical efforts, that were faced by the country, or the challenges that were faced by the country. So SARS very quickly, created resources and capacity to deal with appeals from a number of foundations whose objects may not have allowed them to play any role in the COVID-19, efforts, which was quite, quite important. I mean, I'll just give you an example. One of the foundations that I serve as a trustee of, were not able to play any role because the objects were quite specific and very limited. And we had to change the MOI, and we approached SARS, and literally within 2 days, SARS came back and approved the amended objects. And that allowed that foundation, which is the First Rand Empowerment Foundation, to play a role and to participate in particularly the efforts that were, meant to support government to deal with the health response, humanitarian response, as well as a number of other areas, including innovation in the space, which was quite an important thing. It was quite an important outcome. And apparently they dealt with quite a number of foundations that wanted to play a role. So that's, that was quite an important thing that actually showed us what's possible, because previous to this, it may have taken a couple of months or even a year or more for SARS to give their opinions on whether a non-profit company, for instance, qualified for PBO status, whether you qualified for Section 8 status. And what this has shown is that, in fact, like in a lot of other areas, we've seen service delivery suddenly starting to happen very quickly, where it may have taken government years to deal with some of the issues. And I think thirdly, South Africa is quite unique, and this comes from the National Development Plan, in that the National Development Plan created the necessary environment for collaboration, for partnerships, and for social compacts. So and this has made it possible. So if you just look at in the education space, we have the National Education Collaboration Trust. We have the NACSI, which is a coalition of a lot of NGOs that work in education. We have ISFAP in higher education. We now have the Solidarity Fund. And all of these are social compacts that are focusing on particular challenges that we face in South Africa. And I've spoken to a lot of other countries, especially in the education space. They do not have structures such as we have, these collaboration platforms that we've created in the country. And if you just look at business for South Africa, which is a collection of organized business that is able to respond as a collective in addressing some of the issues, it's quite an important South African innovation. And obviously, I think what we saw was how a lot of foundations were, especially those that were already ready and maybe their objects, allowed for them to get involved, acted with a lot of speed. There were a lot of meetings and they continue to happen where foundations are looking at how they respond, which meant, addressing some of the areas in which they may have been focusing to shift the focus to be able to get involved in the COVID-related initiatives. Next slide. And I think what we've seen is really an opportunity for business, NGOs, CSI, and government to work together in the future, in the post-COVID environment. I think this is going to be particularly important, especially if you look at some of the key challenges that we face as a country: inequality, the ability to produce skills, unemployment, and poverty. I think there's a huge opportunity for us as a country, given what's happened with our response to COVID, to work together. So, because I think we can accept that, especially if you look at the constraints, the fiscal constraints that we face, that I think government realizes even more so now that they will not be able to deal with the social problems and the social challenges by themselves. So they need, partners, and which is quite important. And that creates an opportunity for reforms to be driven, collectively by the social partners. So the social capital which is developed in the country, which is really quite important, and we can leverage off going forward. The next slide. I think if we just our work in education, I see, a lot of discussions and challenges of the status quo, the role of education, because what we've seen, especially perhaps if I look at, the divide between those that have and those that, come from poorer backgrounds, whether it is in the schooling system, on the post-school system, we're starting to see, how COVID-19 and the nationwide lockdowns have amplified inequality, have amplified, the differences between those that have access to digital devices and technology and broadband access and those that don't. But what it is doing also, it's starting to put a question on the value of education. I think we're going to see more of that, especially as more and more people end up unemployed. Because we already had this problem in the country of unemployed graduates, as an example, of youth unemployment, which is really, really high. I think we're going to see more, questioning of the role and the value of education, going forward, especially, in the context of the need to produce skills and competencies and resilience amongst people to deal with change. It doesn't matter what it is going to be in the post-COVID environment. The next slide.
Okay, we have 2 minutes, please.
Yeah, and this is the last one. I think what we're going to see is generally, a question on everything that we do. So, whether it is business and the economy, in our context, in our country, I do think we're going to see an amplification of debates and discussions around the concentration that we have in South Africa, because we have big business, we have big government, we have big labor, and the SMMEs are going to be the ones that are most affected by the COVID environment and the unemployment and so on. So I think, that debate hopefully will focus on what kind of economy do we need post-COVID. And foundations, are in a very good position to participate in the discussion, but also in the initiatives and innovations around how we deal with inequality and poverty in a much more meaningful way than what's happened up to now. I think our government is a lot more open to work in partnerships, which is quite important, and that may have an impact on our politics, our geopolitical environment. Technology, I think, the inequality that we see in the technology space is something that is going to come into sharp focus, especially because, we've seen what's happened, and the government has some policies, even decisions that were made long ago. For instance, how we digitize our economy is going to be in a lot more sharper focus going forward. I think how we look at the environment is going to be even more important, and therefore NGOs and foundations are going to play a very important role in these discussions and the debates. And of course, how we reshape our society going forward is going to be, particularly important. So we've seen, foundations sort of respond to the crisis, to the emergency. I think what a lot of foundations are now starting to do is to look at the next. In other words, how, do we reshape ourselves as foundations to look into the future? And I think that presents a huge opportunity for our foundations to stop doing some of the things that they've been doing up to now and start doing new things that are going to have a much bigger impact, especially as we see the emergence and the growth of social impact investing. Thank you.
Thank you. I think that your point about this crisis showing that there's a capacity for collaboration that we could build on after this is over is especially encouraging. So we'll just take some questions now. Okay, so we have one from Begin Corsi. Why do you think SARS and other government departments could respond so quickly, given that it was the same government departments that took longer to do this under normal times? And has COVID-19 exposed some of the unneeded layers in government processes?
Yeah, I mean, clearly there's a crisis. So, I think this just shows that with a lot of political will, there are a number of things that we thought were not possible that are actually possible, and they can be done. And I do think that, if we just adopt that approach of not wasting the crisis, there are a lot more things that still need to be done in reforming our economy, and doing some of the things that our government has not been able to do. So there's absolutely a big opportunity there.
The next question is from Shane, who asks, what drop in income do you see for foundations across South Africa post-COVID-19? And in a post-COVID-19 environment, how can government leverage more support and partnership from foundations and the private sector?
So if you look at the economy and what's going to happen, and just maybe going back to Peter's presentation, earlier on, almost all sectors of our economy, other than maybe some areas in technology, some areas in retail and maybe gold, for those NGOs or companies that operate in those sectors, they may be protected and may even grow, somewhat. But every other sector is going to be negatively affected. And what's going to happen with foundations, because typically there are two types of foundations. Either you have endowment foundations, or you have foundations that get transfers and raise money on a regular basis. All of them, other than those that get the benefits or transfers from those sectors, the few sectors that are going to be protected are going to be negatively affected. It means you can expect foundations' incomes to be down by anywhere between 15 and 30% at least from about next year. And that's why it's quite important for foundations to do stress testing, to look at the areas of focus, to cut costs and improve efficiencies, but also to refocus, because there are new opportunities that are going to emerge, and be part of the conversation of how we meaningfully deal with inequality, poverty, and unemployment, or the production of skills.
Thanks. I think that's a good point to move into our next presentations, which deal in some ways with some of those issues. Thank you, Sizwe, for sharing your insights and your time with us, and I hope we can speak again soon.
Thank you. Thanks, Ed.
Next up, we have our chairman, Dr. Stuart Theobald, who will be outlining some suggestions around how foundations might go about managing their portfolios in the face of the substantial market volatility that we've been seeing over the last couple of months. So over to you, Stuart.
Thanks very much, Zohib, and good Afternoon to everybody, and thanks particularly to our external speakers, Dr. Goodman and Mr. Ngasana, for your presentations. So one of the issues we've had to deal with, of course, is severe financial market volatility in the face of this crisis. And you'll see there on the graph what that's looked like. The dark blue line is what's happened in equity markets, and the orange line is what's happened in bond markets from a domestic. This is on the JSE. And there's an unusual feature to those in that both equity and bond markets saw a sharp negative drop at the same time in the wake of the crisis. That's unusual because traditionally we think of bonds and equities as uncorrelated, at least, and sometimes even inversely correlated. But in this crisis, the two have moved in the same direction, which has meant overall portfolios have really been affected. But you can see that there has been a fairly strong recovery. We hit a bottom in the sort of late February, and since then recovery has been fairly steady. And we're now, in fact, on bond portfolios at slightly above where we were at the beginning of the year. And equity portfolios are about 8 or 9% down from where they were at the beginning of the year, which has been a really strident recovery. And that, of course, has been driven by global fiscal and monetary intervention. So a wall of money coming from central banks and from governments that really needs to find a place to go. So a lot of cash is in the system looking for yields, looking for any kind of return. And some of that money has ended up flowing into emerging markets and into South African instruments. Now, this, particularly from a bond point of view, is very helpful for government because it is going to have to raise a lot of funding. And initially, the spike in yields meant that that was going to be far more expensive. But at the moment, things have calmed down, and issuance by government looks in a much better state than it was. But there is considerable uncertainty remaining. So we will see data and corporate earnings coming out that's really going to reduce the uncertainty around how companies are actually performing. There's certainly going to be some shocks as well as perhaps shocks on the upside, but certainly we expect companies to be sharply negative in earnings, and that's got to feed into share prices. So our own view is that the recovery is welcome, but perhaps not something that should be relied on. Now, as Sizwe just said in concluding, from a foundation's point of view, if we move on, so there are considerable concerns, particularly if one is reliant on an endowment as your main source of funding, that asset values are going to be diminished at exactly the time when one probably needs to rest on portfolios a bit more. So usually we expect foundations to apply broadly an asset liability management framework. So that just means that foundations strive to match assets to their cash flow needs. So would ensure that nearer term needs have instruments that mature in time with cash needs. The challenge with an asset liability management framework is that it doesn't cope very well with unexpected events. So often from a liquidity point of view, portfolios are tied up into longer term investments that are designed to mature when ordinary planned expenditure was needed. And now, just from a cash point of view, those aren't available. Usually, an investment strategy will include some emergency tranche of easily accessible funding that can be accessed in an emergency. But I think the current environment goes beyond the planning that any foundation would do. It's an order of magnitude beyond the usual risk perspective. And one therefore has to think about alternative needs. Obviously, there are parts of portfolios, usually the long-term parts, that are invested into higher risk instruments, equities, etc., that can be liquidated at the moment to meet exceptional needs. But of course, then you risk permanent diminution in capital because that particularly the higher risk parts of portfolios are there to drive capital appreciation and to ensure that real returns are protected over the long run. So it's quite a dilemma from an investment point of view as to how foundations should be coping with the crisis. There's, first tier of emergency funding that can be accessed, but then if the question starts to come into eating into asset allocations that are designed to protect the real value of an endowment, one starts to affect long-term outlook of a foundation. Zoe, if you could move on. I think as Intellidex, we've done quite a lot of work in trying to support government with thinking through what forms of funding government can access. And we've developed a social bond concept for the sovereign to consider that accesses and taps a new marketplace that the South African government has never been before, which is social bonds appealing to ESG investors to contribute investment into the specific fight for COVID-19. And it seems to us that that kind of creativity and innovation in funding is really important at the moment. And that can apply also to the NGO sector and to foundations. So there's probably never been a greater need for outcomes-based funding mechanisms. So South Africa has now introduced social impact bonds. There have been 2 examples I'm sure many of you have had some experience of. And it does seem to be a good case for social impact type of investments at the moment that can be marketed to potentially a global investor base. Now, social impact bonds are complex. They involve many partners, very difficult and time consuming to put them together. But given, as we've heard from speakers before, this unprecedented level of collaboration and speed with which government and the private sector has been able to act, I think that it's worth considering what kind of impact and outcomes-based funding mechanisms we can put together. We've also been pondering whether now is the time that one could create a specific COVID-19 crisis fund to help NGOs that face real problems. So we've heard about the Solidarity Fund, and one wonders if there is a separate fund that could be specifically designed to support NGOs who are facing both crisis from a drying up of normal sources of funding, but also crises from just exceptional need and pressure on them to deal with the current problems that are being faced. So we think that that's something that could be considered and could aim to raise global aid agency money. There is an international example in the START network that is already set up and is doing that. And there might be opportunity through coordinated foundation action to design a consolidated funding mechanism like that. There's also a question about blended finance mechanisms, and this is a way of leveraging existing spend at the moment. So while we're under pressure and really need to make a big impact, blended finance potentially provides a means to increase impact with a given level of funds. So one of the problems in the crisis is that the informal sector is really facing a serious curtailment of economic activity. There hasn't really been much government intervention that directly reaches the informal sector. The assumption has been that the additional social grants overlay with the informal sector to some degree, but that's only partial. For instance, Gauteng has both the most, has the most informal sector employees per population, but among the lowest social grant recipients per population. So there are some mismatches, and the collapse of the informal sector is going to be very serious. And for those foundations looking to support the informal sector, blended finance model is perhaps something that could be mobilized fairly quickly, where you combine grants with debt in order to provide concessionary finance to informal sector businesses. There are some attempts to do this. So the SA SME Fund, for example, has put together a model that they're now planning to launch in Gauteng, with support from the Gauteng government to provide concessionary loans to informal businesses. And there's potentially a way for foundations to use their money as part of those sorts of initiatives to leverage the amount of money that informal businesses are able to access at the moment. And then, as Cesar said,
1 minute, Stuart.
Okay, are there ways that the foundation sector can work more closely with suppliers and customers in the corporate sector to provide interventions? Clearly, the large corporate sector are involved in multiple forms of supplier development programs and into customers. And they have an incentive to protect those and to work with suppliers at the moment to ensure they can survive the crisis. And that's one mechanism by which corporate money can be consolidated with foundation money to ensure better outcomes. So these are just some ideas that we've been pondering about. Certainly, if there are any feedback and questions, we'd be very grateful for it. Thanks, Zoe.
Thank you, Stuart. So I think what I'm going to do is, given the time, I think we'll just go straight into Grant's presentation, and then we can have questions addressed to both of you at the end. So joining us from Washington, D.C. is our head of strategy, Dr. Grant Kruger, and he's going to be showing us how we can use scenario planning as a tool to adapt organizational strategy in response to the epidemic. Okay, over to you, Grant.
Thanks very much. And thank you to the preceding panelists for very interesting and certainly thought-provoking presentations. So thank you very much. And then also, of course, thank you very much to all the folks joining us now on the webinar. Welcome. One of the things that I find or have been finding incredibly difficult is to deal with this, just the influx of information that has been coming at us. We're dealing with a situation in flight, and we're all scrambling to find solutions. And as we were thinking through some of the ways in which we make our own business resilient, as well as help many of our clients, both private, public, and in the nonprofit sector, think about how to respond to the crisis, there's one very useful tool that we have in strategy called scenario planning that can help us think through how we prepare for the potential futures. And I think that's important to underscore, is that it's very difficult to predict the future. None of us can control it. But how do we prepare for what could potentially eventually play out in how these scenarios, or at least the potential consequences of some of these issues that we're dealing with. So what we're representing here on the right, if you see the graphic there, there's a sort of, as I call it, a kind of linearity in the stages that we are expecting. And that's maybe a fairly normal response to think we're dealing with a crisis, so there's a firefight, and then government is telling us there's a phased reopening, and then what we'll need to do is re-engineer for a new normal. That's kind of been the narrative that we've been dealing with. We are concerned as a research and a strategy team that linearity of thinking is potentially either overconfident or underconfident in some instances, or that there's levels of over-optimism or over-pessimism, that there's levels of over-prediction and under-prediction. And like I said earlier, the way that we can think through how to deal with this level of uncertainty, we draw on scenario planning to help us think through how to plan and what to prepare for. So in essence, the core help that scenario planning gives us is it helps us to separate things into two buckets broadly. What are the things that we know something about, and what are the things that we're certain about? And then we can assign probabilities to. And then the second dimension to scenario planning really is, what don't we know? What is uncertain? And those are the two big separations that we can make. So if we start with the big uncertainties, which is where we start with the scenario planning, we have two major questions around health and the second big question around the economic outlook. So here's the question on health. What if a vaccine or treatment, and when will a vaccine or treatment for coronavirus be available? And then secondly, on the economy side, is when, if at all, or when will the economy recover? Let's be optimistic and use an optimistic question, but when will that economy recover? So if we look at the representation of the scenarios on the next slide, you can see how those two questions help us to draw out potential futures. If you look at the diagram on the left-hand side, let's start there. You'll see that what we're talking to there are the public health interventions and outcomes. At the top, the outcomes in the public health sphere are strong. At the bottom, they're weak. And look at the horizontal axis now. What about economic policy? When will the economy recover is the question there. On the far left, we've got a flawed economic policy intervention. And then on the optimistic side, a highly effective policy outcome. That gives us an intersection of 4 potential futures that we're dealing with. So the first one, bottom left, we're calling it the big shrink. So what happens there is that you've got a global pandemic and a prolonged recession. The second one, if you go up, is called limping along. This is where the virus is contained. So you can see the public health interventions have a strong outcome, but the economic response, the economic policy response is weak. And we're seeing damage coming out for businesses and maybe even sectors of the economy overall. Next, we look at number 3, which is a healed and thriving economy, that's the really optimistic outcome. Vaccines or treatments are in place very quickly. The phased reopening of the economy happens, but a full recovery is entirely possible. That's very highly optimistic. And then if we go back to one of the fourth scenario there, that is where health or policy interventions are weaker, but the economic recovery is strong, and there's a sort of phased recovery in the economy. And that's the one that we call the brave new world, where the virus mutates, it recurs seasonally, but the economy adapts and recovers. So we'll just dive into a little bit more detail about each one of these scenarios very quickly. So here we go. So what are the salient features of the big shrink? Well, like I mentioned earlier, the public health interventions failed to contain the spread of the virus for a long period of time. We are unable to find vaccines. Our treatments are ineffective. We are continuously sheltering in place, and there's a continuous enforced lockdown. The economy suffers as a result, and we have stringent measures in place. What happens as a consequence? Unemployment rises, businesses fail, a recession results. Companies and individuals file for bankruptcy, there's default on loans, and you can imagine for the banking industry, there's a potential banking crisis ahead of us. The next scenario we'll look at is what we call limping along. And that scenario, the virus the pandemic at least is brought under control, but the rate of infections are significantly slowed, and the economy is cautiously reopened in phases. But this phasing has a potential downside, which is that you have the industries that have to wait much longer are the ones where there is potential risk for irreparable damage. And good examples of that might be travel and tourism, your hotels and restaurants. Even potentially agriculture may be affected if there's the inability for workers to migrate in the country. So that's our limping along scenario. The next one. Healed and thriving, like I said, is the most positive outcome here. Vaccines are found and economy recovers quickly. Medical research proceeds. The economy is reopened in phases. The outbreaks recur, but we are able to contain them very quickly, but there's no countrywide lockdown. Local outbreaks may occur, and what is incumbent on us in this situation is to take the lessons forward that we've learned in the moment of crisis so that we don't have this mass scale lockdown that we are confronting right now. Our fourth scenario, which is the kind of main characteristic of the scenario, is seasonality. So there is no effective vaccine or there are no effective treatments that can help us in the long term. And if you think about our history, we've really only had very few cases where we found vaccines or being able to eradicate viruses in their entirety in human history. So what's likely to happen in this scenario is that we are seeing the health sector continues to struggle to find a solution, but the economic interventions are powerful enough, or at least they're good enough, like the stimulus packages that were mentioned earlier, the guarantee packages that we are talking about are effective and they are able to sustain the businesses. The economy recovers, but it is a brand new normal and a brave new world. So what do these scenarios help us to do is they help us to separate out, like I said in the beginning, what is certain about the situation, what is uncertain about the situation, but it also brings a level of comprehensive analysis to the table that enables us to prepare an organization for any of these potential futures to play out. And the smart thing to do in any of these scenarios would be to think about what is certain and what is common in all of the scenarios, and then what is unique about each of the scenarios. Specifically for the foundations, the questions and what was interesting about the inputs that we've gotten from the previous panelists is they've touched on some of these implications that I've listed here. And these are the big questions that we think foundations should be asking themselves right now, is what is our strategy and what does it look like in each one of those 4 scenarios? What are our objectives? How do they change? How do we measure impact? And what are the outcomes that we're looking for? So the biggest question here is what is the future of the foundation, and what is our contribution to South Africa going to be in any of those 4 futures potentially playing out? The second issue we think foundations should be concerned about from the outset is what's happening in terms of governance. So this is a really important issue, and you can think about it as we are confronting the crisis right now. 2 of the other speakers have already brought this up as a potentially thorny issue around the independence of foundations and the extent to which foundations can continue to pursue the work that they have intended to do in their own strategy and their own memorandums of incorporation, and what pressure they may face from the corporate sponsor. We already are, with some of the foundations that we work with, are finding that this is becoming an issue that they are confronting, where there is pressure from the sponsoring company for the foundation to redirect its own funds and its own work to support potentially the supply chain or the value chain of the corporate sponsor. Then we visit the question about who the beneficiaries are, and of course we understand in the empowerment and trusts or the BE trusts overall, beneficiaries are Black people of South Africa. But if in light of those future scenarios, how do we refine what that focus needs to be? Where is our attention going, and how do we actually make an intervention that is both powerful and effective for the beneficiaries that we identify in those 4 different kinds of futures? Operations, how do we continue to operate as a foundation in light of the fact that we are, for example, in this current environment, forced to socially distance? Are our operations set up to continue the work in environments or in a situation in which we don't have a normal working situation? How is our operational structure set up to cope with that? Fund disbursement and cash flow, again, where do our funds go? How do we ensure that the foundation has got adequate cash flow to sustain its operations? And what are we funding? Should we be redirecting some of our funding to be supporting some of the issues that have been highlighted in today's presentations? That's one of the really big questions that we're asking about those future scenarios again. And then where Stuart brought us to in terms of his presentation was the question about the asset management and what is happening with the fundamentals of the endowments of the foundations, and how are those foundations endowments being protected against potential risks in each of those scenarios going forward. What can we do to move the conversation forward? These are our suggested next steps for any foundations. One is it's really important in terms of the scenario planning approach that you have a forward planning team that is able to both inform immediate action, but is looking one step ahead of where things are coming and working out what the foundation's responses needs to be in each of those potential future scenarios. The best thing that we can recommend to everybody is to take the learning scenarios, as we've called these scenarios that we've presented today, as a stepping stone towards your own future decision scenarios. And that's the difference. So you go from learning scenarios to decision scenarios, which then enable you to help answer those 6 big questions that we asked thematically about your organization. Then obviously there's a lot of information that is already circulating, but are there any questions that we don't have answers to? So your next important step is going to be to identify research needs and where there are gaps in knowledge. Then you could quantify those models, or at least the questions, and then develop your quantitative models and figure out what the implications are based on your budgets and based on your scope of impact and what your intended strategies are. And that leads you to be able to define your response strategies in this with this level of uncertainty, in this kind of world where we just don't know where things are going to go. The best thing we can do is to be prepared for any one of those 4 futures that are potentially likely to play out as the virus develops. Thank you very much.
Thanks, Grant. It's a lot to think about. And unfortunately, we've only got about 5 minutes left for questions. So let's just jump straight into those. So from Shane, how do we channel funds towards more impactful foundations and projects?
Is that question directed at me?
I think that Shane was asking that during mine. Shane, I think the channeling questions are really important and happening at the level of Solidarity Fund and at government as well. Where do you have the greatest multiplier effect in spending? I don't think there are any easy answers. I think maybe Sizwe has got some thoughts as to how in this environment one selects projects. My own view is that it's about multiplier effects. Where do you go that can take a relatively small amount of money that you're putting into something and have a maximal outcome? And that can often be where you're leveraging other sources of funding and you're opening up opportunities. Maybe Sizwe, you have some views on that question of Shane's.
Yeah, so yeah, I mean, it depends what you mean by impact, because just looking at the crisis right now, I mean, there are a lot of humanitarian efforts. And if you are, for instance, involved in feeding schemes and things like that, is that impact or do you define impact as more long-term? So I think funders as well as foundations are probably going to be a bit more discerning in the next phase and the future phase, because I think we've got to sort of think of it just listening to Grant with the scenario planning. There's a now scenario which is really just dealing with the crisis. And in this current crisis, measuring impact may be very short term, because it's just, how do we get people to at least survive in the short term? But I think funders and foundations will have to start thinking of the medium to long term in terms of impact and reviewing, just using that grants framework, reviewing what they've done up to now and identifying based on the scenarios where the biggest return on investment, and obviously a return on investment is not just monetary, it is also social impact, is going to be. I think this is where, again, looking at what you were saying, Stuart, in terms of, allocation of limited resources, in the medium to long term, impact is going to be about how you balance, the financial and the social impact for sustainability. Thank you.
Okay, thank you, Sizwe. I'm afraid that we have run out of time. There are a couple of questions about how these scenarios could be put into use at scenario planning from a practical perspective. Please feel free to reach out to us via email. We will also be sharing the slides from today, as well as a recording of the webinar with everyone who's attended. But yes, please reach out to us if you have any other questions that you'd like to engage us on. And yeah, thanks very much, firstly, to the 5 speakers who I think it's been really enriching and given their time to provide us with that information. And thank you also to everybody who's attended. We hope to hold something similar again soon, and yeah, would be grateful for any feedback. So yeah, thanks and enjoy the rest of your day. Bye.